Thank you, Scott. Whoa, loud. That's better. Again, I'm Murray Harbor, the Executive Director of the Mississippi Business Group on Health. On behalf of the membership and board of the Mississippi Business Group on Health, we're happy to collaborate as a co-host for this summit. This would have been our 9th year of doing it at Mississippi College, so we're happy to bring people together. The Mississippi Business Group on Health is a venue in which we try to convene and bring all parties in the healthcare system together. For a long time, we've been wanting to push health and employer health as an economic impact driver, not just from putting people into, bringing people in the state and bringing business into the state, but getting more value out of the healthcare that's there. Today you'll hear from 3 panelists, of which we'll talk about that as well. The business group has been growing, having more reach. We have 22 events this year, last year 15 events, and it's all about getting people together to have meaningful discussions about improving value-based healthcare. You know, we'll do everything from a diabetes meeting. I know we had Tradition, we were down at Tradition, or Bay St. Louis, we had Traditions, and Dr. Berger talking about diabetes and metabolic health. We have annual meetings, we have pharmacy meetings, so it's all great to be here. Today you're going to hear from 3 employers who have shown excellence by winning Healthiest Workplace Awards. One of the things we do, the business group, we do learning opportunities, but we also promote best practices in employer health management. That is a set of check marks that you need to do to have a healthy culture, healthy benefits plans, which help you attract and retain top talent in your organization. So we're very happy to work with the Mississippi Business Journal, the Mississippi State Department of Health to bring out the Healthiest Workplace Awards. Each of these organizations have won the award at least once, if not twice, or more than that. The other thing we do is really promote value-based care around the state, and we work with health systems, many of them that we mentioned today, on trying to align, get employers and the health systems and plans and the actual patients, which would be employees and dependents, together to do more. We have a health consumerism issue in this state. We have a low technology issue in this state, so the more we can do, the better it will be. The 4th thing we do data. We have a data warehouse of which we're starting to accumulate data, look at it, and do some reference-based information for the people in the data set so they can do their plan designs. And you'll hear some on plan design as well. So let me see where we are here. We have the slides. There we go. Well, first, I'm going to call on Edmund Hughes. Edmund is with Ingalls Shipbuilding. He's the Vice President for Administration and Human Resources down on the coast. They have a city, pretty much, and they've been doing a lot of things for a long time to help create a healthy culture for their workforce. What I'm always fascinated about is their employees today were grandchildren of their employees many years ago. So, Edmund, why don't you tell us why people are important for you?
First, thank you for inviting us, and we greatly appreciate receiving one of the Healthy Workplace Awards. What really makes it special for us at Ingalls, you know, we have 11,500 employees on the Mississippi Gulf Coast, so we're not only building great ships, we're helping to build a healthy workforce, and that requires a lot of the organization. So the cornerstone of that is our human capital strategy as an organization. I mean, the building of ships is extremely labor intensive, and it's not an easy job, and it's hot in the summer, it's cold in the winter, and you want individuals who are truly kind of industrial athletes who are really building ships. So what do we need to do as an organization to help achieve that? A few years ago, our organization decided to make an investment, and I truly will say that it's an investment, because you're making an investment in putting in a family health center that you may not see that return for years. And so the organization made a conscious decision to put in a family health center. The family health center is located about 8 minutes from the shipyard. If you're on our health care plans, you and your dependents are eligible to participate, but you can get your physicals, you can get your health care treatment. It has a CVS on site. You can get blood work drawn, x-rays. There's a nutritionist, diabetic Okay, yours is out too. All right, we're back. Okay. Did I say something you didn't like? So diabetic counselors, wellness coaches, that's all part of our Family Health Center. This year, we actually added vision services to it. So there's a vision center at our Family Health Center. About 36% of our workforce actively participates in the Family Health Center. If you choose to use the Family Health Center, you can still go to any doctor in the community that you want to, but there's a discount if you decide to use our Family Health Center. So we're very, very pleased with that. But that's just one part and one component of having our employees focus on healthy lifestyles. We also have an actual fitness center on site. It is a full gym, so there's full basketball courts, racquetball courts, Zumba classes. So we make that having a healthy lifestyle choice. We want to make it as easy for individuals as possible. We really did this to give our employees easy access, and the wait times are less than 10 minutes. I know we've all gone to the doctor and you probably sat in the waiting room longer than you actually saw your doctor, but that doesn't happen at our Family Health Center. So that's really what we started as an organization, and it's just one step in helping to make our workforce healthy, and we've been very pleased with the results so far.
Great. Billy's I guess, Senior VP for Policy Services that has HR under him. Keeps getting more and more as he goes under at Southern Farm Bureau Life Insurance Company. And I know in conversations 10 plus years ago, you were questioning some things and you had some conversations. Tell us about why you made decisions to really start putting the pieces together yourself.
One of the first things and I wore my boots in honor of the governor today, so. One of the first things that caught my attention was probably about 10 years ago. I went to a program, and it was a health wellness program, and Bill Ray, who is the CEO of Bank Plus, spoke about losing 60 pounds and how much that changed his life and the emphasis he put on health and wellness for his team at Bank Plus. It was very powerful to hear the CEO say that, and I realized the importance of having top management to help you. The second thing was, not long after that, my CFO, Larry Favreau, who eventually became our CEO, he said, you know, these increases we get 5 and 10% every year, he said, we either got to get a new game plan or a new HR guy. So I said, well, let's try that first one. And so we started putting together a wellness program, and you know, I ran in, Murray actually was moving into this area, and I happened to run across his path and talk to him about wellness, and he had an extensive background. My thoughts on wellness was to do a lot of big things. You know, we sponsor a bunch of things with Southern Farm Bureau Life, including some walks and runs in the Watermelon Classic. But he said, you got to do a lot of little things to engage your workforce. He said, you also need a champion, somebody who keeps the flywheel moving all the time. And that's when we hired Matt Ginn, who heads up our wellness program in addition to other areas in our company. But we started it, and we started engaging our employees. We now have an on-site clinic, and we have a lot of cool stuff that we do. But we started with a vision that we can make a difference. And some of the things we've done, especially with our on-site clinic and getting a third-party vendor that handles our case management and disease management, who has a lot of technology, a lot of case management, we have just killed the cost. I've gone 3 years without an increase in my health plan. I went 30 years, and I had one time we didn't do that. So there are a lot of things, a lot of low-hanging fruit. There's a lot of inefficiencies and a lot of things that if you do a collaboration like we're doing with hospitals and doctors and clinics, but employers were missing that voice. Murray and I started the Mississippi Business Group in 2014. Now we have I don't know, about 60 companies. And it's a voice for employers to say, you know, we want a seat at the table as we talk about these changes. The old models of healthcare, they're just not going to work. We're looking for, you know, different payment systems and accountability, but there's a lot of cool stuff going on. You know, as I have worked with people like Evan Dillard from Forest General and Chris Anderson from Baptist, Stephen Dobbs from Merritt Hospital, Lester Diamond and Deidre Bell from St. Dominic's, Alex and Shane Spees from North Mississippi Medical Center. Those are CEOs and executives, CFOs, that are sitting down in rooms and listening to how do we make this better. I think a lot of employers thought the ACA, Obamacare, or whatever you want to call it, I think they thought that that was going to be our answer. Defined benefit plans. How many of y'all still have a defined benefit plan? Most companies don't. We do at Southern Farm. We're one of the few. But they did away with it, and from a cost standpoint, they just turned the DC, defined contribution 401k, type plans over, so the cost went way down. They got out of the business mostly. With healthcare, employers thought we'd just hand it off to the government, let them run it. I always say, if you like the $8 billion the post office lost last year, you're going to love what the government's going to do with healthcare. So, you know, the government's not going to solve those problems. To me, the best thing that came out of the ACA and Obamacare is it's got employers and hospitals and doctors working together in events like this through a collaboration of trying to make things better. You know, you look at the core things going on in healthcare that we'll talk about today, but there's a lot of ancillary things that are challenging too. One being mental health for children. You know, my 30 years, unfortunately, I've had kids that we put through treatment and later on they commit suicide or they get bad drug problems, things that I saw were very inefficient in the system. And I see groups like John Damon with Canopy Services addressing some of these as a private thing. I see long-term care. Very few people are going to be able to afford long-term care. It's over the top expensive. So what are we going to do with this aging baby boomers who need a place to stay? They don't need a nursing home, but they need an assisted living. There's a place in Jackson called Harmony Court that a lady named Angela Wright owns. They started it about 5 or 6 years ago, bought a motel, and they now have it full, 100 people with a waiting list. There's huge needs that are part of the trail of health care that I think employers can help address. Number one cause of bankruptcy in America, healthcare costs. And, you know, that is real eye-opening. And even with good health plans, you have a lot of challenges. And so with our programs at Southern Farm, we're trying to help the immediate needs of our employees and their families.
All right, now, there we go. Jim Brown, down here, he's a First Vice President and Benefits Director at Trustmark National Bank, and you've been doing some great things. And you tell us a little bit about your plan design and options you've been doing and to change your workforce.
Sure, Murray. I've been working at Trustmark now for nearly 18 years, and I can honestly say I've had a really good executive team to work with. A lot of the stuff that I was bringing came from my training I had at Blue Cross and Blue Shield of Mississippi, believe it or not. I thought they did a really good job bringing a lot of stuff to us. But when I got to Trustmark, they were looking at, okay, we're spending all this money on healthcare. How do we help management? How do you limit that risk? How do you mitigate some of these things? And we said, well, there are plans that you can put into place that can help with those costs and help you, at the end of the day, actually help the employee be a healthier employee. So one of the things that we looked at was we went back and we looked at our benefit design. Back in 2003, wellness was not covered at 100%. But the Trustmark executive team said, you know what? One of the things that people keep telling us is these barriers of why people aren't going to the doctor. Why aren't they getting services? Well, the first barrier costs money to go get it. So what we did was we made the wellness program 100% free. And later down the road, that's sort of been part of the ACA, they made that to where everybody said, okay, that needs to happen. Some of the things that we did, we started actually bringing care to the employees. And what we did that was through what we call health fairs. Over the years, that sort of has transpired into where we actually go out and we go to about 95 locations this coming year, and we'll actually do a finger stick so people can get their results right there, right then. So that access point is becoming a little bit closer to them, and we're hoping to be able to do some more stuff with the incentive programs. A couple of years ago, actually I guess it was 2009, we started tying you going to the doctor, getting your Healthy You visit or your wellness visit. We also tied that to the health risk assessments that a lot of people take nowadays. if you're not doing anything with that data, then it's a waste of your time. But what we do is we take that data back, and that's what we say, okay, well, what else can we do with our health plan? So over the last couple of years, some of the other plan design changes that we've made in our benefit plans was when people come in, if they want to participate in a diabetes education program, I'm going to give you free diabetic supplies. I'm going to give you a free glucose monitor to where, guess what? Again, I'm removing those barriers. So we always wanted to try to figure out how do we get that better engagement. And what we do is we keep looking at what are the barriers. So over time, we continue to make these changes. And so what we have seen, especially here in the last 5 years, and to Billy's, what he was just talking about is our costs have been somewhere in the neighborhood of 1 to 2% going up versus the national averages of 5, 6, and 7% over the years, and we've been able to sometimes keep our medical costs flat. And I'm here to tell you, in an economy that in the last several years, when you talk, and if you go out and look at the exchange today and you see some of the rates that people are paying for healthcare, you're going, how are you doing that? And I think it does come down to that design. And the employers are the ones that can actually put this into place. It does take planning. It does take a time. You have to get feedback from people. But that's the only way you can really build that wellness program that really makes a difference to where people are actually, glad that they're part of the program.
Great, thank you, Jim. Billy, now to you, thinking about picking your partners. I know that you've taken time to really take an approach to identify what you're looking for in partners and finding those that are willing to work with you and come together with you and making innovation. Tell us about that.
Well, y'all can see I've had a dose of health care here lately. I had shoulder surgery. My surgeon, Dr. Chad Hoseman, last night sent me a text, said he couldn't be here today, that he was tied up in surgery, but he said, make sure you wear that brace. Yeah, as we put this together, it became very critical that we had the right partners. There has been some in and outs, and different people have different partners that fit their culture and their needs. But the first partner that if you've got as a broker or consultant, make sure you got a broker or consultant who's not hanging on to the old school of managing a health plan. I see that a lot, and they're managing like, somebody who's giving you IT consultant, they're telling you we got to stay on the mainframe. You got to get brokers and consultants that see the new technology, that see the things that are happening, that's got the vision to see what really makes a difference. Another one is, depending on the type plan you have, if you're fully insured or self-insured. If you're fully insured, you're a little more limited. But for the self-insured plans, make sure you've got a really good third-party administrator, not just paying claims. Paying claims for self-insured is just like riding down the highway and throwing money out the window. You got to make sure they've got good technology, good case management, good disease management. I had a third-party vendor. I couldn't even get my own records. I had to, weeks and months would go by. I could not even get my own records. They had old technology, and the new vendor we've got, UMR United, they are really crisp, get off technology, great case management. So those things are very important. And then pharmacy cost, that's another thing we looked at in our partners, because the pharmacy cost is running out the ceiling. I mean, you can easily have a $10,000, $50,000 a month bill, especially with these chemo drugs, a lot of things that they treat Alzheimer's. So you got to have a good pharmacy partner also. The other vendors that you use, such as on-site clinic, it's important. That is a huge cost savings. It will knock your socks off if you've got about 300 to 500 or more, the savings with an on-site clinic and the things they can do, especially if they've got the capacity to do a lot of data analytics. Look at your data from your health plan with the identifiers for HIPAA and mix that in with what's going on in the clinic and set a plan of action. So that can be very powerful. Both of these guys have on-site clinics, and they can tell you they're very powerful tools to use. So, and then also other providers working with physicians and hospitals and imaging systems. You got to have providers, you got to have communication with your hospitals to help you. You can't have a plan where, for instance, they go in network and then they go to have an MRI or something, they get bounced out of network. Well, that puts them about $1,000 extra out of that employee's pocket because it raised their deductible. You got to have providers that are in tune with doing the right thing in the right direction. This one of the things about today, seeing the turnout, is getting them guided towards the right way. A lot of direct contact. We're direct contracting with things for bariatric surgery, for things like diabetes. So we're starting to get out of the box with the TPAs and do a little bit more direct contracting. And then one of the biggest partners is your employees. You got to make them accountable for their health. About 75% of what people are treated for are things we do to ourselves, and then we want a doctor or pill to take care of it. So it's extremely important. We spend a lot of time. Murray does a lot of consulting with us. Matt Ginn does a great job leading our wellness team. We have Laura Nail on board, who's our nurse practitioner, and we use a clinic called Vigilant Health that has unbelievable data analytics and disease managements that we're doing. But again, the employees, we have a lot of things that we do to make them accountable to help us make our plan profitable. And once you get them engaged, it's amazing the impact they can have on both their health and on our cost.
Great, thank you, Billy. Jim, you've got people in many states. And, you know, I know that Edmond and y'all have got 2 facilities, Newport News and down on the coast, and Billy, you're all kind of pretty much in one place. But Jim, you're in 5 states. You got people all over. How do you manage the multi-site considerations?
Well, you know, I call it being geographically challenged. Trustmark started in the state of Mississippi, and so we're pretty much all over the state of Mississippi too, but we are in 5 other states, and we've been looking at how do we take our programs and get it to the people where they're at. Like I said with the health fairs, that when we go to 90 different locations, we go to Texas, we go to Tennessee, we go to Alabama, we go to Florida. And when we go there, you know, a lot of times, some of these people, for some people, it's their 1-year annual checkup. It's amazing. It seems like every year I get at least one phone call from somebody saying, thank you so much, because I had no idea that I was a diabetic, or I had this problem with hypertension. And, you know, I talked earlier about removing those barriers, and a lot of that barrier sometimes is just getting people to some information, getting them tools. So one of the things that we've been doing at Trustmark is working with different partners. We actually partnered with St. Dominic's and their Healthy Lives program. They're the ones that actually help us with those health fairs. And so we've been able to use some of the data that they've been collecting. We take that back and we go back and we see, okay, what are our biggest problems? And so what we're able to do is through this age of electronics and through portals and through different ways to where people can access everything from a recorded session where people are talking about nutrition and or, you know, just getting your blood pressure checked on a regular basis to, you know, actually having our clinic, which our clinic also supports us too, is having these diabetes education programs. We just recently started with our clinic. We have now started what we call remote health coaching. A lot of people don't know what health coaching is, and it sounds sort of strange, but it's not health medicine. And so there are some different rules, but one of the things that we're finding is it's a little bit easier for me to do health coaching than it is to do health medicine. And I think this is real important when you start talking about managing certain diabetes or hypertension. When you start to talk about help managing that, you sometimes need that coach. You need that resource that you can go to and say, okay, what can I do? Who can I talk to? Our clinic usually refers out every month to either different doctors or hospitals in the Jackson metro area every month, about 20 different referrals, because they find things. And we're like, you know, you really need to go see an endocrinologist, or you need to go see a cardiologist. And we'd like to think that, you know, through those programs, now that we're going to be outreaching through the telehealth portal, that we're going to be able to do this in the other locations, not only in Mississippi, but also in our other locations. We're really now we're fixing to push out our first high deductible health plan, or consumer-driven health plan. And one of the things that's going to allow people to do is to put their spending of their money for healthcare in their own hands. And so what we're hoping is all these tools that we've been able to roll out is going to allow those people to say, okay, who do I want to go see for these situations? And hopefully provide them with ways where they could actually see, okay, here's the people that we need to see, and I can get help here, not necessarily just through Trustmark, because they may want to go to a professional. So it hasn't been easy, but we're definitely crossing those lines.
Great, thank you, Jim. Edmund, you're a government contractor down on the coast, and every time I see something, you're doing stuff in the community, lots of community involvement, and plus I think just economic impact of getting new things to build down there. Can you tell us a little more about Ingalls in that area?
Yeah. So one of the things that is important to us is how do we involve the community in many of the things that we do as an organization. And so next month, September 29th, please mark your calendars if you don't have anything on your calendar. Our annual 5K on the Causeway is scheduled that morning. But it's an opportunity for our employees to, some run, it's an actual certified race. Some walk, some just go out for a morning stroll. But the proceeds from that race, last year we had about 900 participants. This year we hope to cross that 1,000 barrier. But the proceeds from the race actually go to the Special Olympics. And it's really become a community event. And you have many of our providers, you have Singing River Hospital, you have just everyone comes out as part of that event. But that's just one way we like to get individuals involved. When you look at, and I was listening to, as you were talking about referrals for services, we work closely with the doctors in the community for colonoscopies. We work with them to ensure that employees have easy access from a scheduling standpoint. You also talked about, and I've heard it in a lot of the conversations today, high blood pressure, diabetes, obesity. Those are the reasons you put in a family health center so that you can address those issues as early as possible. Because if you can address it and individuals take on the responsibility of changing lifestyles, that's going to pay off. Why do we do it as an organization? We do it because we celebrate when you get to 40 years of service at Ingalls Shipbuilding. Well, if you have 40 years of continuous service with our organization, and you started probably when you're 18, you're 58 years old. And at 58, you may have a couple of ailments that you've gathered over a few years, but we're also a workforce that we have generations of shipbuilders. So if mom worked there, dad worked there, kids worked there, grandfather worked there. So that's why that family portion becomes so important. So if Junior is going to come to work at the shipyard in the future, we want Junior to be as healthy as possible. And it becomes part of our overall strategy. And if you're going to have generations of the family, then we want to create and pursue that individuals are pursuing a healthy lifestyle. So we involve the community in that process as much as we possibly can.
Great. Edmund, I'm going to keep it back with you, so keep that in your hand, please.
Oh, okay.
Now, if you were to give any employer or anybody out here top 3 things they should be considering before they leave here when it comes to employer health, what would that be?
So I would say there's not one silver bullet. There's not just one thing that's going to solve the problem. So if we go back several years, we looked at changes and design issues in our healthcare plan. Then we looked at if you were a non-smoker, you'd get a discount on your health care plan. Then we looked at changes to deductibles on emergency room. Then we looked at implementing the Family Health Center. Then we implemented Teladoc. Then we added Vision. So over a period of time, we've done a lot of things that I think ultimately have an impact. Part of it is making it convenient to your employees, giving your employees a reason to want to change their health care and their lifestyle habits. So if you have a cafeteria, what kind of food do you offer in the cafeteria? Is it fried chicken or is it salad? So there's a lot of different things that can be done to help impact. There is not just one silver bullet that's going to change it, and it's going to happen over a period of time. I was listening to some of the individuals talking about some of the numbers. trends for our company from a healthcare standpoint have been below the national average. And I think it's because of all the things that we're doing as an organization. It's just not one thing that's made that happen.
Jim, what are 3 bullets you would give everyone if they're considering to moving down this road like y'all have?
Well, I think, you know, between me, Billy, and Edmund, I think you realized you really just need to do something. You know, it doesn't have to be huge. It doesn't have to be life-altering for everybody. But if you as an employer, you're out there and you do just a little something, and, you know, I was told one time, if you give somebody a T-shirt for participating, you can get them to do just about anything. Well, that's about right. But now we're talking about their health. And so, you know, if you're just doing the little things, I hear it over and over and over. It's the little things that matter. It's the little things that matter. And it is. You know, it's not so much that it is a silver bullet that, you know, that you're going to go out there and you're going to, oh, this is going to fix everybody, because it's not going to happen. So I would encourage those employers, just do some of the little things that you can do that are in your control. The second thing I would tell you is, you know, if you want to build an exceptional wellness program, it's going to be ever changing. You're going to have to reevaluate it. You're going to have to review it. You're going to have to retool it. Because if you're doing those things that we've been doing, which is, and all of us up here do, is you take that data back and you find out, okay, so what do we need to be working on? Is it something that we need to do is talk about mental health? And how does that affect the workplace? You know, you hear about it on a regular basis, but it seems like very few people do anything about it. So then what you do is you figure out, how do you make that part of your program? If you start working it into what you see and what those employees see, it's amazing the buy-in that you get from those employees. And finally, I guess the last thing is, you know, I heard this many, many years ago, that the health of a company is directly tied to the health of the employees and their families. If you think about it, that's really true. I mean, how many people do you know that come to work every day, they're always happy, they seem to be always doing something, always got a smile on their face, and you know what, those are the people that tend to do a lot for that company, versus the ones that come in that looks like they're dragging around, maybe they're not feeling too good that day, and you know, those days will happen for all of us. But if you can do something that helps those folks come in, be healthier, figure out ways to help improve their lives, because that's what you're doing. You know, I think everybody in here, if you're an employer, you went into business to do what? To make money, okay? Well, then all of a sudden you have these employees that are working for you. You'd like to think that they'd all be happy and healthy and come in every day. But then you realize, guess what? There are problems. So, you know, one of the things I think Trustmark's been really good at, and I'm very proud to say that I've been a part of this program, is that we have reached out, and we did try to come and help people really do make changes in their lives. Not just because they work for Trustmark, but because they do have families, they do have children, they do have people that depend on them to come to work every day. And I think, you know, if you're that employer, if you're helping get those people to that place, I think you'll see that your dividend is going to be a much better employee that's going to be more productive. And I promise it definitely is going to affect that bottom line.
Thank you, Jim. Now, you know, one piece of data I guess a lot of people don't realize is when you look at the direct health care costs of an employee to employer, the health insurance cost is only 30% of the total cost. The other makes up absenteeism, productivity, and then wage replacement. So it affects many things. Health affects not just the health cost, but the productivity and absence of the employee that are there. Billy, the final 3 things that you would like to impart on the group.
You know, I think one of them is certainly you can start small, as Jim said. I think you have to make sure you engage your employees, that's critical. I think that in my case, I'm fortunate in that I have a lot of resources. I got a medical director, Dr. Dave Dudleston, who's been really a key cog in doing this. I got an attorney, Jeff Stires, internal, that helps us with a lot of things. I got a top-of-the-line clinic with Vigilant. I got a consultant, Leslie Arcana and Scott Dunwall, who have been with me for 20 years. They've switched companies a lot, like Witness Protection Program, but I've had the same I've had the same consultants for a long time. So I've had a lot of resources a lot of people don't. I've got it, you know, Matt Ginn and Laura Nell in our clinic and Matt in our wellness program. I've got a lot of resources a lot of people don't necessarily have, but I didn't always have them. A lot of those resources, they're out there. You can get consulting advice from, you know, Mississippi Business Group on Health real low. There's a lot of opportunity to grow those plans. I think you have to do it too in a positive way. It's not about just cutting costs. As employers, we used to say, well, let's just keep raising that deductible. Well, I didn't have but a small raise this year, but I shifted and doubled my deductible. So what did the employee do? They just quit going to the doctor because I don't want to pay that money. So we did a lot of things in the past that probably hurt us, and I think you've got to make it positive, and you got to encourage your employees. There is a tremendous opportunity to save money. In discussions today with, and last night with Evan Dillard, who's retiring CEO at Forest General, he talked about the importance of efficiencies in hospitals, and that is important, and it's important that we recognize that we can't affect cost control and have a negative effect on the quality. You know, when you look at what companies spend on health insurance, these three companies here, I'm going to guess any given year we spend somewhere between $5 and $30 million on health insurance. I have no idea what these guys spend, but I know the size of their companies take it out there. Big ticket on the balance sheet, and it's important that we try to do the best we can, but the old way of doing business is not going to work in the future. It's got to be a different model that balances the employer and employees and quality and cost. And things like this and the collaboration of healthcare, I think, are going to make the difference. The government's not going to solve our problems.
Billy, tell us a little bit about your cost changes that we've had. Billy?
The cost change. The impact of it. That's a trick question. This is a trend line that shows, and you can see it's all scribbled up. We take some national data where we look at, you know, companies our size, things in the South, other financial services. Southern Farm Bureau of Life is one of the largest domiciled Mississippi companies, financial institutions. You know, Trustmark's one of the other ones. But if you look at those lines, we show those national trends. You can look at the line that is the red line. That is the line that we were on before we started implementing a lot of the things that we're doing. And it was on a constant upward trend. And projecting an aging workforce, you could project that red line just going up and up. All the things that we implemented is in the green line. We feel very comfortable showing this, that those things had a dramatic impact, and that's shown by, you know, our reserves went from almost nothing to we got a really strong reserve, and we also have not had to have an increase in 3 years. So when you look at that, I've had some people that were, you know, in the medical field saying, I don't know how you would do that. It makes no sense. There's got to be some catch to it. If you do the right things, there's really no catch. There's just a lot of positive things that you can impact your trend line like that.
Edmund, I know that y'all look at work comp and health and stuff. Tell us a little bit about your impact from a data perspective and cost perspective.
Yeah, first, I'm looking at his chart, and he's absolutely right. Our trend lines look almost exactly like that with the initiatives that we've put in place as an organization, we're falling well below those national averages as an organization. One of the things that we're really pleased about is that over the past probably 6 or 7 years, our workers' compensation cost, and I think everyone on the panel may say that that's a significant cost of doing business, but in the shipbuilding business, it is a tremendous cost. And with many of the initiatives that we've put in place, we've seen about a 48% reduction in our workers' compensation cost as an organization. And we've been very pleased with the number of the initiatives, and it really does involve including healthcare providers in that process as we look at how we ensure that individuals that are coming to work for us have the physical backgrounds to do the kinds of work that we do, and it's really had a tremendous impact on us. But at the end of the day, when you look at your health care for your employees, we really focus in on 3 areas, and it's really having a healthy body, a healthy mind, and a healthy wallet. If you think of all of your employees that come to work every single day and they're worried about paying bills and all of those things and its impact on absenteeism and all of those other things, we've added that last focus this past year in helping our employees actually with financial counseling. We bring in an outside person to help in that process. But if you look at your employee from a holistic standpoint, you've covered all the bases, and we think that one's going to also have a major impact on our organization.
Great. Jim, how about y'all's cost and other information like that?
Sure. One of the things that we've recently started doing, you know, technology has been a wonderful thing. And don't know if y'all have been to a bank lately. How many people have walked into a bank lately? Not a whole lot of folks, because you're doing it online. So, you know, one of the things that we're doing at Trustmark is we're trying to figure out what do we do with these branches, because some of these branches are really nice, got big space, and we were trying to figure out, okay, what are some of the things that we can do? Well, me and my wellness coordinator, because I'm lucky enough that Trustmark allowed me to have somebody come in, and she helps us coordinate all of our wellness programs. And if you are an employer out there, I'm here to tell you, having somebody that's leading, like Billy said, it really helps having that person that's sort of saying, here, I'm the point person, we can get these things set up. But so what we decided to do was, you know what we could do is, we offered health fair to our employees, well, why not offer it to a community? So last fall, up in Canton, Mississippi, we've got a nice main branch up there. They got the word out to the community saying, hey, we're going to have a health fair for the community. And sure enough, we had several people walk into the branch and come and get their blood pressure checked. We have done this again over in Vicksburg, and we're seeing that people really like this. We're having a very positive effect. It doesn't hurt that they're coming in and seeing our branch too, but we're also seeing that, you know what, the employees sort of like this too, because they feel like they're helping their community. And you know, when you're wanting to engage those employees to be more healthy, they become a little bit more conscious. You know, I think we've all talked about Evan Dillard up here. As you can tell, he's an active person. I was talking to him too, because what we want to do next now is actually reach out to those communities and get some of those possible hospitals and or clinics involved in helping us sponsor some of these places, because we've got potentially space to where they can do it without having to, you know, tie up a clinic all day. So we're thinking there's some really good opportunities, and we're hopefully seeing that, you know, when you start making those relationships and you start getting those employees making those relationships with those doctors in those communities, then I think that's going to help everybody, both from an economic standpoint, but also from the health of your employees.
Building on that, Edmund, how are y'all engaging? We got a bunch of providers in here too. What would you like to see from the provider community as an employer to do deeper engagement?
Well, one, we have wonderful relationships with many of the providers, and we actually have a representative here from our corporate office. So Amy Iverson, raise your hand, turn around, look at the crowd. Any providers interested in talking about, see that lady? And that's the answer to the question. Anytime, Amy.
Amy's a great one. We were on the national speaking circuit together. She tells a great story about your program out there. Billy, what do you see as furthering down the road of engaging providers and systems into better value-based care?
Well, I'd like to say, too, I see Debbie Headley, one of our other nurse practitioners. That's the greatest invention ever. Our employees love those nurse practitioners. One of the things that's happened, you know, that we sort of fought early on is, you know, a lot of the medical community worried about these on-site clinics. Matt Ginn and I went out to Phoenix about 3 or 4 years ago to a national on-site clinic convention, and there was about 300 or 400 people there. All the big companies, Shell, General Dynamics, IBM, they've got clinics like hospitals, but you were seeing that trend start up then, and now it's exploded. But what it's done is increased the direction to the right facilities. You know, our nurse practitioners, we have nurse practitioners and some docs that rotate in, but they catch stuff early and they refer them to the right people. So I don't think it has any kind of negative. It's a very positive effect. I think the medical community is reaching out a lot more to us, especially through Mississippi Business Group on Health, trying to see how can we get engaged with y'all more, whether there's direct contracting. Who are the preferred doctors and clinics that are making a difference? And communication's a big part of it. You know, my surgeon here, Chad Hosman, he's one of the best communicators I've ever been around as a doctor and following up with his patients. When Laura, Nell, and Debbie refer somebody to a clinic, they want somebody who's going to get back with them, help give them updates, that's going to help in the follow-up. So I think that we're seeing that change where they're becoming partners that they understand it can be a win-win for us and them if they communicate and work with us. I'm just super encouraged by some of the things I see these clinics and hospitals doing and reaching out to employers, and I think we're going to see an improvement in the quality. You know, as the governor talked about, we've got a lot of gaps in rural Mississippi because the rural hospitals are shutting down. They can't afford to operate. There's a lot of gaps with our general practitioners. So telemedicine and all those things that are happening, I think the employers are going to be a real key to make those things work.
Thank you very much. We're going to turn it into kind of some question and answer here, and I need someone to take a mic out to the audience. Chris, would you help me, please? Chris Morgan works with us at Mississippi Business Group on Health, and he's going to, anybody got questions for this panel? Raise your hand. There's Dan Gibson. Dan is with Massey, Mississippi Association of Self-Insurers, a great partner with us at the business group.
Thank you, Chris. And yes, I want to just say, Murray, I tell you, hats off to you and Mississippi Business Group on Health and what you've done. And we've been very excited to be a partner with you over the years in raising the awareness of health and wellness here in Mississippi. But just enjoying this conversation and remembering a meeting that we had, Governor, we appreciate you so much. You are such a health hero for the state of Mississippi. And in 2014, he is. And I hope one day we'll see your name on some of these buildings that wouldn't exist without you. I remember in July of 2014, you were gracious, Governor, in allowing some of us to come and meet with you in your office. And Murray, you were there, and Billy Sims, you were there. We had with us Lex Taylor from the Taylor Group. We had individuals from Holmac Corporation and others around the state. And we went to the governor with an idea we had that really was inspired by what y'all are doing at Southern Farm Bureau. Billy, saving lives and improving lives. And so the idea was a workplace wellness tax credit. And it would be a tax credit offered by the state of Mississippi to employers who have qualified wellness programs for their employees. And Murray, you helped us write the bill. And we put criteria in the bill, and Governor, you were the very first state official to show enthusiasm for this idea, and we'll never forget it. And you spoke at our conference that fall in 2014. We then got with the Speaker of the House, Philip Gunn, and under Philip Gunn's leadership and the leadership of Jeff Smith, that bill passed the House of Representatives almost unanimously in the years 2016 and 2017. We got with Commissioner Mike Cheney, who has been a cheerleader from early on. And so, you know, if you're going to get something health-related passed at the Capitol, you got to have the support of various state officials. And I just am really grateful to say we've had the support of the governor, the speaker, and the insurance commissioner. Now, sadly, it has died in the Senate every year since introduction. And because of lack of support in the Senate this year, the Speaker chose not to report it out of the House. We're disappointed in that. However, we're encouraged that at least we have been able to raise awareness of this issue and how it could help. And the reason I'm speaking to this now, Murray, and thanks for letting me, is just so that everyone can be aware that this is an idea that we have floated that would be very good. If you look around the country, there are only 3 states that we can find, all northern states, that currently do this, that offer a workplace wellness tax credit. Mississippi could be the first southern state and one of only 4 states in the country to do this, and it would just be yet another tool in our economic development toolbox for attracting industry into our state. We consider it a no-brainer when the governor of our state loves the idea, when the Speaker of the House loves the idea, and when the insurance commissioner loves the idea. And next year is an election year, and I hope that those other candidates who are out there will be asked the question, why don't you support workplace wellness? Because it's a win-win. It saves lives, it saves money, or y'all wouldn't be doing it, and it definitely can help move Mississippi forward. Thanks for the opportunity.
Thank you, Dave, and the state. Questions for the panelists? There's over there. Ms. Karen Womack.
So I have a two-part question for the employers. You've all talked about your worksite wellness champions. And so my first question is, are your champions, is that their job, or is it just an add-on to another job that they already have? And if it is their job, how important do you see that as something that needs to be a dedicated job?
In HR, that's other duties as assigned.
Well, Huntington Ingalls Industries, the individual who is actually responsible for it, it's her full-time job, and she is sitting in the room, actually, so she came here to see what we were doing in the state of Mississippi. So it is a full-time job of that individual. Some of the individuals that support and champion, they do it in addition to what goes on. I mean, I am one of the champions of our 5K on the Causeway race. It's just important for our employees, and I think as a leader in the organization, part of my responsibility is to lead by example and to participate in those kinds of activities. But we do have an individual that is their full-time job to make sure that we have coordinated wellness and there's a path forward in continuing that improvement.
Yeah, Murray gave me some advice early on that if you don't have somebody that, or a function that's almost full-time, it's going to go by the wayside. In the old days, wellness, they gave you a pedometer and signed you up for Weight Watchers, and that was wellness. When we brought Matt Ginn in, he probably spent about 75–80% of his time on wellness. Now Matt's role has expanded, but he's got a team of people that every day there's a focus on wellness, and there's that flywheel synergy going all the time to keep it going. If you don't, you lose that involvement and engagement by your employees. So if you've got somebody doing it as a sideline and it's about a third or fourth duties, it probably doesn't get done at the level you need to really be effective and see the kind of cost savings that Edmund and Jim and I see.
Same thing, just like Billy said. I mean, we started off, we call her a wellness coordinator. It is actual position, and her main job is to just do that, is to coordinate wellness throughout the whole system for Trustmark. And, you know, some people think, well, how is that a full-time job? Well, when you have as many sites as we do, and you have the programs that we're having to do, plus she also coordinates a lot of the care for the clinic. She works with several of the folks in our, what we call our human resource representatives, who are out with all the different locations that we have, coordinating everything from, okay, yeah, we're going to, you know, try to have an education fair there for nutrition at your location on this day. It takes a lot of time, and like Billy says, you have to make it a priority. And Trustmark did this. I think I've had mine now for 7 years, and I'm here to tell you, it has made a tremendous difference.
Great. Question?
Yes. Statement first and then question. I want to compliment the panel. Excellent presentations all. I had the experience of coordinating the Plan for Life for IBM in the state of Tennessee, 5 sites, under U.S. Corporate Health Management, which was started by Jonathan Fielding out of UCLA. And later on, he sold that to Johnson & Johnson Corporation. It's now called Johnson & Johnson Health Management. Now, the point made earlier about the cost savings and the benefits are all accurate. The data support that. I spent 51 years as a health educator, health promoter, and everything that I know, in fact, I was a health coach, I guess, before that term was even invented. So The question I would ask each of you is, are you using lay health workers as well? Can you speak to whether or not you actually have some of your employees that kind of serve as a lay health coach, helping the professional health coach? Thank you.
I'll start. One of the things that my wellness coordinator actually is, she actually does have her registration as a PT and as a nutritionist. So she also can play that role. So we don't have as many lay people doing that as we want. However, that's why we're using the tools that we have. And we're using our clinic and some of the other partners that we've got come in contact with. We're using them and their resources because they're the professionals. I mean, I'll be honest with you, we're in the business of banking and insurance. That's what we're good at. We don't want to get too far into managing people from a standpoint of their health, but we sure want to give them the tools. And what we try to do is, we do have several people that I have helped train. People call me on a regular basis saying, okay, well, how do I get in and set up my health fair visit? We just launched a new app this year so people can actually do it online themselves. So we are pretty well trained as far as how to utilize the tools that we're offering our employees.
And I guess the question, when you say lay people, we have some of our employees that lead like Zumba classes. We have outside dietitians that we rotate in. We do a lot of lunch and learns, and it might be our medical director. He's, among other things, a shark killer and a cook. So he does maybe a cooking class on healthy eating. We have our cafeteria manager come in, but we have a lot of our employees that are engaged in lots of health-related activities that they lead functions either at lunch, after work, that they blend in to assist our experts. But again, with a clinic, you want your practitioners and your real experts at the high level, but we do involve a lot of our employees, and it engages the employees overall to have this camaraderie and sort of this team building.
We probably have very similar, but there's not a group of lay individuals who are tasked with that function. One of the things that we're really considering, one of our locations has an employee resource group that's a wellness employee resource group. So that's one of the things we're considering down the road. But there are a number of professionals in our organization handling those responsibilities.
All right. One more question up front here. Chris, last question right here. This young lady on this third row. She's the next contestant on The Price is Right. All right. Come on down.
Hello. I just had a question about how do you get your employees to be motivated about taking advantage of the resources that the company offers? And I heard earlier about you hold your employees accountable for that. What do you have in place for that?
Well, we do discounts with our employees on their health insurance if they do certain things, and of course you got to follow the guidelines. There's some wellness federal guidelines as far as what you can or can't do, but we do some discounts. We give away free t-shirts and gift cards and stuff like that. You got a certain percentage of your population that's super motivated. They're going to do the right things whether you got anything or nothing. There is a certain group that, you really have to push along, but we try to encourage them in a positive way and give them lots of opportunities, but we have prizes and gifts, and Matt and them do a good job of putting some rewards out there. But that discount program is super popular, and it makes them engage at a certain level with things we're doing that make a difference.
Edmund?
We've not yet gone to the you get a discount if you do certain things. I think it's on the horizon, and I think it will make a difference longer term. Amy. But at this point, it's the individuals volunteering to participate, whether it's a fitness challenge, whether it's participating in the 5K, whether it's volunteering with other items. But we have not as an organization yet said you get a discount on your medical costs if you wear a Fitbit or if you do the screenings. So we've not done that yet. I think it's on the horizon, but it's not yet implemented in our organization.
And to that point, we actually did this. Like I said, we actually started that back in 2009. The health fairs have been really good because that's where, believe it or not, that's where we give away T-shirts to $200 gift cards. And I mean, you know, sometimes it takes that for some people because it's like, okay, how do I get those people engaged? And it's not always easy. We also utilize a survey to try to find out, okay, how do I get you, Mr. I don't want to get off the couch and, you know, don't want to do a whole lot. How do I get you to come in and at least talk to us? And I think one of the things that we're finding out is it is a sort of wide variety of things. And so I think one of the things that you as an employer get to do is you get to sort of experiment. And so we've been able to do that. We've tried different prizes. And it seems like, you know, the variety does help.
Great. Well, thank y'all very much. Again, I want to thank Scott Waller and his team at Mississippi Economic Council and the Governor Bryant and all your support and leadership in promoting health in this state, and along with Mississippi Medical and MDA, Glenn and your group. Again, thank you for letting us be involved with this. That concludes our part right in time. So let's give everybody a hand, please.